Is it more challenging to provide high-quality healthcare in rural communities across the Commonwealth of Pennsylvania? Today on Conversations with Clint, I'm going to be starting a 2-week series talking about healthcare in rural communities and some of the challenges that we face here in north central Pennsylvania. We're also going to be talking about House Bill 533, a bill that we have introduced and passed in the House of Representatives and hope to see some action on this year in the Senate. I'm going to be joined by Janie Hilfiger, the president of UPMC Wellsboro and of UPMC Cole in Coudersport, Pennsylvania. So these folks truly understand rural healthcare. So we hope you can stay tuned and learn a little bit about some of the challenges that we face in rural healthcare here in the Commonwealth of Pennsylvania.
So, Janie, thank you for joining us today for our second part of this 2-part series on rural healthcare, and I really appreciate your passion for what you do here in the community, and specifically, you've been involved in healthcare for 40 years. That is crazy, 40 years, and you now lead in the hospital where you began as a staff nurse, serving as the hospital president here since 2012 and the vice president of UPMC Northern Tier since 2017. Thank you for what you do. Thank you for your service to this community. I thought it would be fun for you to take us back to when you started, and I'm sure healthcare has changed a little bit.
Yes, it has.
But take us back to what was it like serving in this industry back in the day and then here today?
Sure. I started my career 40 years ago as an RN, and when I was making my career choice as to where I wanted to work, I knew that I wanted to come back to a home, to a rural area where I could take care of my friends, my family, and so I think it's been an honor to come to home and take care of patients. So at the beginning of my career, it is amazing when I look back over the 40 years and how things have changed. Just to give you an example of a couple of things, everything we did was on paper. And so there was no electronic health record. There were no computers. Everything that we did involved a piece of paper and somebody transporting that piece of paper from one department to the next.
Wow.
To get tests ordered, to do anything. It was all paper. And if we were transferring a patient, was standing in front of a copier and copying hundreds of sheets of paper to make sure that that information followed the patient. So if I just look at the documentation and the paper that we used, my favorite story that I tell is when I started, I would take care of patients that were having cataract surgery.
Yeah.
And so the cataract patients would be on bed rest for probably about 5 days. We would keep them flat in bed. Their whole hospitalization for a cataract was 7 days. Today, a person comes in the morning, has their cataract removed, and the length of stay is about 4 hours.
Wow.
So just incredible changes as far as the technology that we have, the surgical instrumentation that we have, the communication that we have between all of the different parts of a healthcare system. It's just amazing. So if we have a transfer that's leaving today, we don't have to copy any paper. That transferring hospital has the ability to access the computer, has all that information. We don't have to worry that we missed something.
Yeah.
They have access to that computer information. So it's just been incredible to watch the changes and how we have progressed and the level of care that we provide. I think in the past there are patients that we would not have kept at our local hospital because they may have been something more than what we could care for. Today, our hospitalists do an excellent job being able to take care of patients that have that are more complex than what we've been able to do in the past. So we don't have to transfer patients like we still do, but we don't have to transfer them as frequently as we had to in those days.
So one of the things that I learned a lot about early on in this job was just how important it is that we have the designation as a critical access hospital. Explain to folks exactly what that means for a rural community and for a rural hospital to have that critical access hospital designation.
Well, I started that journey several years ago for our hospital, so I know it inside out, and I am so thankful that we have that designation across our nation. So is especially important for small rural hospitals that struggle financially, that may not be able to offer services, and that patients have to leave their area to have that done. Being designated critical access, it affects how we are reimbursed for the care
Okay.
that we provide. It also makes us eligible for the 340B drug program, which companies on an outpatient drug charge us less for those drugs, and so really helps the financial stability of a hospital. And what I look at here is that if we weren't critical access, we may have to limit some of the services that we would provide here, meaning that patients would have to leave the area to receive those services. And by being critical access and that reimbursement that we get, it helps us to grow programs here, that patients don't have to travel, that we can bring in specialists, that we can bring
Right.
in different services. And so I think the critical access designation for us has been wonderful. There are 2 rules that we have to follow with critical access. The first one is that we can't exceed an inpatient census of 25, and that's totally inpatient, and it
Yeah.
does not include babies, and that we've been able to manage that very well.
Great.
And the other one is a 96-hour length of stay average at the end of the year, and we've never had to worry about exceeding that 96 hours. So the rules that we have to follow, they've been very easy for our facility
That's
to follow
great.
that.
Well, we've been looking at different pieces of legislation. One of the things that we look at is maybe we can draft something that only pertains to critical access hospitals. So it's big for us in rural communities that have a critical access hospital to be able to look at legislation differently, because you don't want to necessarily. It's incredibly challenging to draft something that is not going to negatively affect somebody, and so it's challenging when we're writing something that's gonna. We may get shot down by a hospital in Philly or Pittsburgh or Harrisburg or Reading, but if we draft it in a way that's just germane to critical access hospitals, that's one way that we can kind of, I'll say, tailor fit legislation for rural communities.
Mm-hmm.
So talk about some of the challenges. What would you say? I mean, we don't ever apologize for being rural. We love where we're at.
Absolutely.
We love our community. We have great schools. We have great hospitals. we have affordable real estate. We love being rural. But we do have some challenges that maybe some suburban or populated areas may not have. What would you say are some of the biggest challenges that we see in healthcare in rural communities?
Mm-hmm. I think the first one I would talk about would be our EMS system in rural Pennsylvania. So it is very difficult to recruit the EMTs, which are volunteers, and they have to pay for the course that they take, which is up to $1,000. And if you're going to be volunteering, it's pretty hard for people to come up with that $1,000 to take that class. And then it used to be that EMTs at work could leave their job if a call went out and they could take that call. It's pretty hard today with business the way that it is to be able to stop production, stop business, and let them take those calls. So I think our EMS system is very fragile, especially in our region. And so I think that's one of the challenges we face. We have provided paid staff for the Wellsboro ambulance and for the Mansfield ambulance, but I know that the small ambulance companies out there, we really appreciate the work that they do. It is so important, but I know it's a challenge for them to find volunteers to be able to take those calls. I can give you an example in countersport. It's very difficult to get transfers to the next level of care out of our emergency room there. We averaged 286 minutes that a patient was waiting for transportation, an ambulance with a crew to be able to get to that next level of care. So I've worked with Andy Tom, who is the manager of our pre-hospital, and we worked with the leaders at Cole. We've taken a team over there along with an ambulance, and now we're down to approximately 30 minutes to get those patients out. So it just lends itself to cooperation between the rural critical access hospitals, and if we team up together, what we can accomplish.
Yeah, we have a bill that would allow a waiver system to be in place for rural communities and counties of the 5th through 8th class that they would allow us to apply for this waiver and then be able to maybe adjust some of the staffing requirements, and that would be a huge addition to rural healthcare to be able to do that. Another challenge that we've talked about is credentialing. We talked about this with James Noble earlier in the first feature of this podcast, and talk a little bit about the challenges with credentialing a new physician and specifically how that affects rural healthcare.
Yes, I'm very appreciative of the work that you're doing with that. So when we bring a new provider into our hospital, we have to go through credentialing them with all of the insurance companies that we're going to work with. And from the insurance company perspective, there is no time frame that they have to complete that credentialing so that we can get paid for that service. So that really leaves us in a difficult situation. We have one of two options that we can follow. The first one is that we can bring that physician in and get them started, let them see patients, but then we don't receive any reimbursement from those insurance companies because they're not credentialed with them. And so that's a huge financial implication for our hospital. The second option that we have is to say, we're going to bring you in, but it's going to take 6 months for you to start with us because we don't have you credentialed with the insurance. And so what do they do for those 6 months? They can't afford not to be working. Most physicians have school loans or med school loans that they're paying, and they can't afford to start a position and not be paid for that. So those are the challenges that we face. And so if there were some limit as far as how long insurance companies had to be able to credential those providers, that would be extremely helpful for us.
And that's one of the things that we put in this bill is it's 45 days. We need to be credentialed or we need to have a written reason as to why. And that would be so helpful, especially for rural communities. And we've seen this move through the House. We worked with stakeholders. It'd be really great to see that move in the Senate this year. We're working towards that, but we'll see what happens. So I talked with Jim a little bit about being in a rural community and attracting physicians to a rural community. I mean, you and I talked a little bit about great schools. We have tons of outdoor activities. Go ahead and give your best pitch to if there's somebody thinking about either becoming a physician and then returning to rural healthcare, or somebody that's been through school and they're looking for a place to serve. Give your best pitch for rural healthcare.
Absolutely. I'm passionate about rural healthcare, and so every opportunity that I get when I'm in a group of residents, a group of nursing students, is that this is a wonderful place to come and work. So there's a great balance between work and life, and there's a teamwork that I don't think that you see in bigger facilities. When you're working in a smaller facility like this, you get to know the person that you're working with. You work with them consistently. They really care about you. You really get the opportunity to know your patients and take care of them. We have great opportunities here, so we can do continuing education, sending people to conferences. We bring speakers in here. We have some of the best providers that I think they're top notch. You could have them go to any hospital system and they would be a top performer at that hospital. So you really get the opportunity to build your skills here and to be able to take on new experiences that you wouldn't have. Sometimes it's looked at as a disadvantage in that you may be the only urologist or you may be the only orthopedic surgeon, but the skills that you learn, and now being part of UPMC, they have resources that they can call upon if they have questions, if they want a second opinion. I think it's a wonderful opportunity in rural health. And now we have telemedicine, or we're really working on telemedicine and trying to expand the services that we have. They have access on telemedicine to talk to another orthopod or another urologist and to be able to talk about the case, or even have them do an exam of the patient together and come up with what their treatment plan should be. So I'm passionate about all parts of healthcare, but being a nurse, I have to put the pitch in. I'm really excited because this year we're going to do a summer camp that it's going to be something along the lines about I want to be a nurse, and we're going to start with 5th and 6th graders. And we're going to have them one day at Mansfield University looking at the class classes that they're going to take, but the second day they're going to spend at the hospital, and we're going to have hands-on activity for them in every area of nursing so that they get a feel and get a sense of the different things that a nurse does.
Yeah.
And then next year we hope to expand that into other health careers.
Oh, that's great.
I think we have to start at that young age, really letting people see what it's like to be in a health career and get exposure to that.
Well, you are a testament that you can move up that ladder. I mean,
Right.
that's where you started, and then here you are, the president of UPMC Wellsboro and Cole, and really appreciate your heart for this community and for all the people that are working here, and this whole idea and passion for creating a good team and a team atmosphere working together, and I appreciate that. I'm glad to be able to be a part of it, and hopefully we can continue to work on some of these issues in Pennsylvania, and to be able to make it just a little bit easier to provide high quality health care in rural communities as we continue to do the best we possibly can. So
Thank you, and we appreciate all that you do and that you work with us. You've been here several times, meeting with different groups of my providers, listening to what their issues are, and thinking of ways that you can help us with that. So we really appreciate.
Well, that was great. The last time we had lunch, and you brought the
Nurse anesthetist.
Nurse anesthetist in, and that was so great. I mean, they went back to like the beginning of it, which was Kim and I were, when we left here, we were like, you know what, that was so helpful to like hear the backstory behind why they even exist and what their job is, and why it's so important to have them, especially in rural healthcare. So,
and I think that ties into why it's such a special place to work in rural healthcare,
Yeah.
because we know those stories, we work with each other, we hear the issues, and we look for how we can help them, at,
Right.
like calling on you to come listen to their story.
Yep.
So.
All right. Well, thank you so much, Janie. I appreciate it.
If you would like to schedule a time to stop into our office and talk about any state-related issues, feel free to call 570-724-1390. Look forward to talking to you soon.